This is a Walker Street Doctor update for Friday the 30th of July. I'd like to start by dispelling the urban myth that patients need to book in for a separate consultation with one of our GPs prior to their vaccination. This is really completely unnecessary, as we're working hard to vaccinate the entire patient population of Walker Street Doctors. We have COVID vaccines available to give all of our patients from aged 18 upwards, and both AstraZeneca and Pfizer vaccines are safe and effective. What's the best vaccine for you? The one that you can get right now, which is the AstraZeneca vaccine. We've heard a lot about the benefits to the community of vaccination, but today I want to focus on the individual benefits. First and foremost, the benefit of vaccination is to turn a major disease into a minor one. Immunisations are designed to prevent death, prevent hospitalisation, and to reduce severe disease. And it's also a bonus if they also prevent disease altogether and to reduce transmission. If you're pregnant or breastfeeding, you should definitely book into the hubs for the Pfizer vaccine. The risk of the Pfizer vaccine are small. There's a small risk of Guillain-Barré syndrome, anaphylaxis, myocarditis, and pericarditis. But overall, despite those very small risks, the Pfizer vaccine is safe and it's effective. Also safe and effective is the AstraZeneca vaccine, and it's recommended for all adults over aged 18 who are not pregnant or breastfeeding. Much has been made about the vaccination-induced thrombotic and thrombocytopenic syndrome, which I have to say is extremely poorly understood by almost all of our patients. The TTS syndrome is a situation where antibodies are formed which stick onto the platelets, causing them to clump in unusual places, especially in the gut, blood vessels, and in the central vein inside the skull. And they're not usual places for people to form clots. And this is not the normal mechanism by which people normally form clots. It's very different to all other clots. The platelets then get used up, and so there are a few platelets circulating, and that runs the risk of bleeding. And that syndrome might manifest in its worst case scenario as severe abdominal pain or severe headache, perhaps with neurological symptoms. And the timing of that syndrome is usually between day 4 and day 20, possibly out to day 30, following the first AstraZeneca vaccine. All doctors in Australia are aware of this condition, even though the vast majority of them will never, ever, ever see a case in their lifetime. We're testing for it all the time, and we have the ability to effectively treat it. We have a healthcare system in Australia which is able to manage those sorts of complications. And the outcomes for this condition are far superior to those in other countries because, in part, the Australian healthcare system is superior to most other countries in the world, and in part because the system is not yet overwhelmed with COVID cases. The risk versus benefit of vaccination versus COVID is not a nuanced discussion at this stage. And it certainly is not a conversation that we need to be having individually with each of our patients. It truly comes down to safe and effective vaccine versus a virus causing severe illness and death in the short term, and in the long term, poor health in people of all ages. I would encourage every one of our adult patients who are not yet vaccinated to call our surgery on 99 55 55 66 to book in for a COVID AstraZeneca vaccination immediately to protect themselves and their families against what is an extremely contagious and deadly virus. I hope this update has been helpful.